actually have some exclusive benefits just for our members.
Right.
Have you heard of those?
Like I got check-in, savings.
Nope, it's a little bit deeper than that, but if
Uh-huh.
you come with me to my office and have a seat here,
Okay, well, I'm kind of in a rush.
I definitely understand that. We all wish there was more time in the day to do
Oh,
everything.
yeah, amen to that.
And what was your name, by the way?
Ken.
Okay, Ken, again, I'm Quendolyn.
Okay.
It's nice to
Ken
meet you.
Glenn.
Yeah,
Ken.
nice ring to it, huh?
Yeah, it does.
This is what we're offering here,
Okay.
exclusively to our credit union members again.
Right.
Do you have any family members?
Yeah, I'm married.
Okay. Any children?
Unfortunately, no.
I'm sorry to hear that, that's okay. Also, what this is, it's for our critical illness coverage. Have you ever had any history of health issues in your family?
Yeah.
Okay, what type, if you don't mind my asking?
Well, we had a child that got leukemia.
I'm sorry to hear that. Well, I know that may be a concern for you and your wife. What our critical illness insurance does, it can cover you in the event of cancer.
Wow. How
For
does
you
it
or
work?
your wife. Well, the way that it works, once we get you enrolled, we get you and your wife covered. Whatever your benefit amount is that you choose,
Well, how much is it?
well, it depends on your income. Whatever you want to set up, whatever fits in your budget.
Okay, how long is this gonna take?
Not long at all. I just need to get some information from you. And you said your first name was Ken, that's K-E-N, right?
Kenneth.
Kenneth, okay. That's K-E-N-N-E-T-H.
Correct.
All right, and your last name, Kenneth?
Colgan, C-O-L-G-A-N,
All right, great, thank you. And what's your date of birth?
9/26/1984.
1984.
1, 2, 3, 4, 5, 6, 7, 8, 9.
Thank you. Now, would you want to get coverage for you and your wife?
Well, it depends on how much it costs.
Okay, that's not a problem. Let me get some more information from you, what's your address?
123 West Park Street,
And what city is this?
Orangeburg.
You're not too far from me.
Oh, yeah? Cool. Hey, neighbor.
Hi.
Glenn and Ken, we're neighbors.
Yeah, nice ring, and we can go shop together too. Bring your wife along. Okay. And now that you've taken this important step, you can enter your cell phone number so that if there's any issues or change of premium or you need to make changes or contact us, we can send you a text message directly to your smartphone.
Okay.
All right, what's that cell phone number?
203-901-9867.
Great, and you have a work phone?
800 number, 800-990-7890.
Great. And do you have a home phone or do you use a cell
Use
phone?
my cell phone.
And that's the 901-9867, right?
Yep.
Great. And what's a valid email for you, Kenneth?
kc@ymail.com.
I looked into that. I don't like Wino too much. How does it work for you?
You know, you get it, and you're just too lazy to change it. You know
I
what
got
mean?
you.
I have a Gmail too.
Oh, yeah, I like Gmail. All right. And Kenneth, do you have your credit union account number?
Yeah.
Okay. And what's that? Because what we're gonna do, once we set this up for you with the pricing information, we can set up an insurance account for you.
Okay.
Where it automatically pulls every month, so you don't have to worry about writing a check,
Oh, wow.
calling in a payment. If you forget, it's already taken care of.
That's pretty convenient.
All right, so give me that account number.
237-463.
Great, perfect. And who's your employer?
I work for the city of Orangeburg.
Okay. Tough job.
No, I dig it, you know. There's plenty to do, lots of problems to solve.
Yeah, that's all.
It's like job security.
Yeah, and you like job security. All right, what was your date of hire?
Let's see, I'm with the city 4 years, so it was February 2012.
And what's your gross annual income?
58,000.
Thank you. And how often do you pay? Weekly, bi-weekly?
Every other week. Today's payday, actually.
Oh, good for you. You like payday. All right. And you're insuring just you, Ken?
I'm sorry?
Are you insuring just yourself?
Well, again, I'm not sure, I don't know how much it costs.
I have to fill in a few more bits of information for you. Now, Kenneth, have you smoked cigarettes or used tobacco at any point in time within the last 12 months?
No.
Thank you for that. And let's look here. Then jump to your, and you said you are actively working 17 and a half or more hours a week?
Oh, yeah, of course, I'm full-time.
All right, and within the past 10 years, have you received any medical advice or treatment for, or taken prescription medication for, or had a stroke, transient, ischemic attack, amyotrophic lateral sclerosis, multiple sclerosis, Alzheimer's, Parkinson's, a heart attack, coronary artery disease, heart condition, blood disorder, anemia, emphysema, chronic obstructive lung or pulmonary disease, organ transplant, polycystic kidney disease, chronic renal kidney failure, cirrhosis of the liver, hepatitis B or C, alcoholism, drug addiction, diabetes, and that's excluding any diabetes during pregnancy, but you know you didn't have diabetes during pregnancy, of course. Have you had any of those?
That's a list.
I know.
No,
Alright.
not good.
Yeah. Have you had any cancers, carcinoma in situ, malignant growth, melanoma or Hodgkin's disease?
No.
And acquired immunodeficiency syndrome, AIDS?
No.
And in the past 6 months, has the proposed insured been diagnosed as having test results for which follow-up was necessary or recommended from screening examinations such as periodic mammograms, periodic chest x-rays, pap smears, PSA tests, and blood cults or blood tests?
Nope.
Alright. Have you been hospitalized as an inpatient for more than 48 hours?
Nope.
Except childbirth? And I know these may sound
That would be
silly, but
something.
I know. That'd be a record.
Yeah.
Have you experienced any unexplained weight loss, greater
wish.
than 20 pounds more, other than diabetes?
No. Now you get the fluid, it's like, hey, I lost 10
I
pounds.
know, you're
Yeah.
excited, but you don't want the flu anymore. Have you been treated with 3 or more medications at the same time for high blood pressure or had a reading at or above 150 mmHg systolic blood pressure and or 100 mmHg diastolic blood pressure? Great. You sound pretty healthy, Ken. You take care of yourself.
I do the best I can, you know.
Well, that's great. All right, let's look here. Now, what we can do, because this will pay out cash to you directly. If you were to get any of these covered conditions,
Right.
it pays out cash to you. So do whatever you want. If you need to pay your medical bills, if you need to just take a break you and your wife, get better.
Right.
That's all we're concerned about.
Okay.
We don't dictate how you spend the funds.
Okay.
So what we can do, we can set it up to what your.
Why don't you use the slide, it's a lot easier.
Making it better. Okay.
Just go, that's it, you can move it back
Okay.
and forth.
Well, we can get you $16,000 in coverage. We can also set it to what your annual income is per year. And then we can give you the breakdown, and that'll show you how much coverage. Remind me again, because I did, it slipped my mind, what's your annual, roughly? Was it 58,000? Okay, we can get you that amount of coverage.
Just slide it, put it on, and pull it back and forth.
Okay.
Let me see how that works.
Yeah. So to get you $58,000 in coverage, which say for instance you got sick and you needed to take a year off. You don't have to worry about rent, mortgage, anything like that. What this is gonna do for you is weekly, it's gonna take out $726. And what that does is,
Well, I'm paid bi-weekly.
well, I'm about to explain that to you.
Okay.
The way that works is, every week, this is gonna come out.
Hi. How's everybody?
Okay. It's gonna be the $14.52, and that pulls into that insurance account. So bi-weekly,
Wow, that's
$14.52
pretty cheap.
comes out. And that gives you that $58,000. So if you need to take a year off from work,
Right.
you still have your salary.
Okay,
And again, that pays out cash to you.
right.
And that is set up for bi-weekly. You can get your wife covered, and the way it would work for her, if she were to get ill, God
Oh, can I
forbid,
get more than that?
you can get more than that.
How does that work?
Well, the only thing that would change would be your face amount, which would be the cash benefit that comes out once you needed it. and we would just change about how much more, because we can get you, we can take you up to 63,000 in coverage, and that's gonna take out
Only like $50
$1577.
a month.
$50 a month. Well, the maximum we could do is, it'd be $54.25 a month,
Right,
coming out just for you to get the $100,000 in coverage.
that's pretty good,
And again, that pays out cash to you.
right,
And if we covered your wife, she would receive half of that
okay,
in the event that she would to get sick as well.
for the same $50,
Well, it would increase
okay.
because we're adding her. Is she a smoker or has she used tobacco products or cigarettes in the
Well,
last
I have
couple
to
months?
go, all right? How
Okay.
much more, you know, I'm interested in me for now.
Okay.
Like, could I add her like maybe later? if
You
I-
can add her.
Okay,
We can definitely do that. Let me get this accepted for you, and you had your account number, so that saves us some time. I'm gonna input your beneficiary.
okay.
If anything were to happen, you were to get sick and pass away from any of these, who
Right.
would you want that money to go to?
Well, my wife,
Okay, and what's her name?
Beth,
Okay,
same last name.
and that's COLGA, and that's your spouse. Alright. All right, and we're gonna get you written up here. We have you set up for your insurance account, it's gonna come out monthly. And all I need from you,
It's gonna come out monthly or?
well, it's gonna come out bi-weekly.
Oh, okay.
It'll use that baby. It had it grayed out.
Yeah, because you don't need to,
It's insurance.
it's an
Okay.
insurance account, so it'll all be done by the
Okay.
meeting automatically.
But what I'm gonna also do for you, Ken, is I'm gonna write it up for you, so you can
Okay.
take this information home and insure your life.
Okay, good.
And what, all I need from you is your signature. Just give me your autograph right here. Gonna get that activated. Signed up, you're ready to go. And this is your copy, you can take it home and look it over with your wife. Or if you have any questions, my number's at the bottom, you can give me a call or come in and see me, okay?
All right,
All
Gwen.
right, thank you for your
I'm
time.
Ken. Gwen and Ken.
Yeah, we're doing.
Throw it up with me, Gwen.
All right.